Heller.
Mr. Chairman, thank you for holding today's hearing. I also want to thank the ranking member. I also appreciate the fact that we're holding this so early in the session. This is an important issue, I think, for everybody that's here in this room, and an issue that I think is very important. We raised the question early on about when was the last time we actually had a hearing on women health care issues facing our veteran women, and it had been quite some time. So again, I'm very appreciative. And this hearing doesn't happen unless the chairman decides that it's a priority to him. So I'm just grateful that we're having this discussion. I also want to thank those witnesses here that are with us today for taking time and sharing us your expertise.
The record should reflect that the senator from Nevada was the first person to ask for this hearing. We're happy to accommodate.
Thank you. Thank you. I'm looking at some statistics. We'll shift from West Virginia, I guess, over to Nevada a little bit. And looking at the new hospital that was built down there in Las Vegas. It's a great facility. It really is. But the problem is that they failed to recognize or realize how much use that facility would have, and because of that, after only being 2 years old, they're back to construction and other add-ons to meet the demands. And I think women veterans may have part of the reason that we're seeing these add-ons and this extra construction. I'm just looking at some statistics here. In the past 10 years, I think you alluded to this, Dr. Hayes, that number of women veterans using the VA clinic or healthcare system has increased by 80%. Yes. Last year, the Las Vegas VA hospital served a total of 4,500 plus women veterans. This year, in the first 6 months of the fiscal year, we've exceeded that number. So you can see that it's growing and growing quickly. I guess the question is, are there any statistics out there of what you anticipate the statistics to be for women veterans using our health clinics and hospitals over the next 5 years, 10 years, 15 years, so we can prepare?
Absolutely. Our enrollment projection model was adjusted, actually, when I came on board, to include gender projections, so that we work very closely with the group in OPP, Policy and Planning in the VA, to go very carefully over those projections. We expect that the near term, 6 to 9%, basically kind of what you were seeing year over year. That has been borne out in the last couple of years, so we've had a 29% increase in the last 3 years. We know, however, though, that when you think about the number inside is 7% today, but 11% in Gulf War I, which some people remember, I certainly remember, and 15% active duty, that we're just getting to the point where we're going to have lots and lots of women on our doorstep. And we have to ramp this up even more quickly than we have been. So I agree that we can give you, the enrollment projection model and the numbers at each site and what we project. We're looking at things like space. We now have new design guides for women in space, because we know that we're bursting at the seams for women. We don't have the capacity and resources in place for what's coming in the door tomorrow.
Let me go back to the Las Vegas hospital. Like I said, it has a great women's health clinic in that particular hospital. But if you go up to Reno, that hospital was built in 1939, and clearly wasn't built or had these older facilities are finding quite a challenge to meet some of these healthcare needs. What's the VA doing to meet some of these challenges?
Each site is obligated to do a strategic plan for women. So, and what's important about that is we have a town hall method, and we have input from the women veterans at that site, so that what type of women's clinic or other type of facilities that are going to be built have the input of the local women veterans. So on some sites, we do integrate care with women and men in the same type of clinics, and in other sites, women prefer that we have a standalone women's clinic. So I've been to Reno. I know that they've been trying to expand the space that they had for women's clinic. It's bursting at the seams. But in each site, it has to be based on the local needs, and we're supporting that through an oversight of the strategic planning nationally.
So I would anticipate that you'd incorporate into any new building, new hospital, a women's clinic?
Absolutely.
Would you anticipate in the next 10 years that there would be a women's clinic in every hospital across the country?
Within 10 years, that would be my guess. But I think what I can tell you is we've been very involved in the SCIP process where they put in their bids to do more construction. We've been looking at every project because it's not just building a women's clinic that's important. It's, as was mentioned before, it's every site in the hospital, wherever women may go, whether it's the cardiac stress test area, where there has to be the appropriate accommodations for both women and men in each and every one of those sites. So our real effort, while it's looking at, do they have enough of the right primary care space for women or gynecological procedure rooms for women, it's also, do they have the right bedrooms for women and inpatient facilities for women, and every other possible kind of space is adjusted to the needs of the women coming in.
Dr. Hayes, thank you.
Thank you.
Mr. Chairman.